Hello and welcome back for episode 38 of the Noobie Dentist podcast. I'm your host, Dr. Omid Azami. In this episode, I'm actually just featuring an interview that I did for the Dental Head Start podcast hosted by my good friend, Dr. David Keir. David is an associate dentist in Australia. He graduated in 2016 from Sydney University and is doing a lot of great positive things for the dental community down here in Australia. And I'm certainly was proud to be featured as a guest on his dental podcast. The Dental Head Start podcast and blog, I will link to both of them in the show notes. Guys, a lot of great content, a lot of valuable takeaways, and he's managed to have some great guests so far for his podcast series. So definitely check it out, and I'm sure you guys will get a lot of value from it as well. In this interview, David interviewed me, and it was interesting to be on the other side of the microphone and be a guest for once instead of host. So now I can sort of empathize with the guests that come on the podcast and how difficult it can be. We chatted about my history and my journey through undergrad and getting into dental school, sort of my experiences in dental school, and then going on to graduating and finding work and working in Canada and now working back in Australia. So we cover a lot of great topics. I hope you guys get some at least entertainment, if not too much information from it. But it is definitely a fun interview, and I just hope that you guys check out the other podcast interviews as well on the Dental Head Start podcast. Without further ado, enjoy this episode.
Hello, and welcome to the Noobie Dentist podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
Welcome to the Dental Head Start podcast. This week we've got Omid Azami, and Omid, he runs the Noobie Dentist podcast, which is an awesome podcast for new dentists that interviews people from all over the world. Omid started this a bit over a year ago now, and he's produced quite a few podcasts that really have a lot of value. I started listening to this. It's something that actually inspired me to start my podcast. So I really do thank you, Omid, for that, and welcome to the show. How are you going today?
I'm doing well, David. Thank you for having me on your podcast. I must say I'm a big fan of yours as well. I know you've just recently launched, but I've had the pleasure of listening to the first couple episodes, and a lot of great content. And you've put it together really well, which makes me feel bad about my podcast now. But I think that I hope that I can share this episode on my podcast as well to draw some listeners to you, because I think you actually putting a lot of great value into the dental community that we have here. So I appreciate that.
Well, I really appreciate that. And I think we've got the same goals. We want to help students become good dental practitioners and helping people out as they transition. So, yeah, it's perfect. So when you do a podcast, you usually start with an origin story. So do I. So tell us, where were you born and how was your childhood years?
Yeah, so I was born in Iran, and we immigrated when I was quite young, about 6, to Canada in 1996. So pretty much from grade 1 onwards, I was in Canada. I was big into sports growing up. I was obsessed with hockey and soccer. So pretty much until second or third year university, that was probably my main priority in life. Was trying to be active and play sports and compete and things like that. So soccer was a big part, and starting from late elementary school, early high school, I started playing pretty competitive soccer. So a lot of my life lessons and the things I've kind of learned growing up, I think came through sports and team sports and working in groups with people. And dentistry and healthcare in general, the exposure I had to that was kind of through my family. My uncle's a doctor. We have dentists and stuff in the family as well. So growing up, I more so just kind of admired their lifestyle and the things that they had and the respect that they had within the community and from the family members. So that really drawed me to having that cool kind of profession that people kind of look up to you, and you kind of feel responsible for people's well-being. In undergrad, I was kind of doing a sports science, kinesiology degree, and I was kind of struggling a bit at the start of it. I wasn't performing too well academically. I think sort of being away from home for the first time, too much partying, too much drinking, perhaps the academics slid. And, unfortunately for me, in elementary school, high school and things, school came pretty easily. So I didn't really have any study habits or anything that I can really fall back on. So when university came, it was a big rude awakening. I was skipping class, sleeping in, and my marks really kind of suffered from it. So After first year, I kind of got kicked out of my program. So I was like in a general, like non-specified kind of degree. So I had to kind of shape up a little bit and try to figure out like what's important and get my priorities kind of sorted out. And luckily I worked hard in that second year, kind of got back into my stream into like the kinesiology degree and kind of got through it that way. In terms of, getting into dentistry and stuff, it was a bit of a, it's a bit of a tough decision. I wanted to do medicine for a long time. I think like a lot of dentists do probably. And I applied in Canada. I applied broadly, like a lot of Canadians even go down to the Caribbean and stuff to do that, and the US. So I applied to Australia originally for medicine. And I remember for the Melbourne Uni application, it was literally like a sheet of paper and you like had to like fill in all your details and stuff. And there was a box on the top that said like MD and like DDS. And there was like no separate fee. So I was like, I might as well just take DDS as well. And then we'll kind of see what happens. So, a few months go by and I get my med offer. So I was pretty happy. And, I put the deposit down and everything. A month later, the dental offers come out and I was like, wow, I don't know what to do. So that was sort of like my entry into the dental world. I had no experience. I never shadowed anyone. I never assisted. I particularly didn't like it that much. I don't think I didn't have any like ambition to be a dentist. So it was kind of cool. I kind of just jumped in like head first and we kind of figured it out along the way.
So how did you end up choosing the dental program? Because did you get into medicine in a few places as well?
Yeah, so I applied for Canada for a cycle. I didn't get in. It's really competitive down in Canada. We have just, the schools haven't opened up too many spots. So the competition is like quite fierce. So a lot of people are, you have to have like, near perfect GPAs, like good test scores, like volunteer work, research. And even nowadays, a lot of people even have to do their master's degrees and things like that to get in. So it's getting like crazy out of hand. I worked hard in my final few years and I just kind of like had the cutoffs to like be eligible to apply, but I didn't really have like a shot of actually getting in, I don't think. So that's why I started looking abroad, at some programs in the US and the Caribbean and in Australia. Obviously Australian schools are like, quite, well respected and, good programs. So I applied to like UQ, Sydney and Melbourne for medicine and, got into UQ and I got into Melbourne. And dentistry, I think I actually only applied to Melbourne because I think Sydney had to pay separately for the DDS or the DMD and the MD. So I actually didn't apply to Sydney. So I just kind of, Melbourne DDS was a free application. So I just rolled the dice and I said, let's see what happens. But yeah, in terms of, deciding between the two, one was like a practical choice. Doing medicine outside of Canada and then trying to go back to Canada is a bit of a tricky road. Which I'm seeing with my wife now because she did medicine in Melbourne. So, in terms of getting back into Canada for like residencies and like specializing and all that, it's quite tricky because, there's limited spots and it's like a separate application pool for even if you're Canadian, if you studied abroad, you're considered an international medical graduate. So, most of the spots are in family medicine. The top sort of specialties is quite hard to get in. And I wanted to, have the destiny in my own hands, kind of, so to speak. So doing dentistry with Australia, New Zealand, and I think Ireland is like a reciprocal agreement. So I was like, if I do dentistry, at least I know I can go back home, I can move back and I can like practice in Canada, which was like a big plus for me. So that was the major one. The second one, one of my best friends' dads growing up was a dentist. So I kind of liked the lifestyle and he's always like a really cool guy to kind of chat with. And, when I got both offers and I kind of had the decision, I kind of went over to his house and we just sat down on his kitchen table and we drew like this mind map of like career projection and career arc and between doing med and dentistry. And it was like pretty much after that afternoon, that evening that I was there, I remember driving home and I was like, that's it, I'm going to do dentistry. The smile came on my face, especially when he told me like the expected salary of a new grad. So I think he may have had a skewed view because he graduated like 20 years ago, but still I was like, okay, if I do dentistry, it's going to be pretty sweet after that.
Yeah, it's certainly better than medicine, that's for sure.
Yeah.
So it's funny how we meet these people and they put us on that path. Like I worked for a dentist as a dental assistant, had no idea I liked dentistry at all. And then it was his influence that completely shaped where I am. It's crazy. If you'd ticked DMD on the Sydney one, we would have been classmates.
Yeah, so. that would have been pretty cool. A couple of my, like a good friend of mine also went there. It's hard to see how life would have been so different, like being in Sydney versus Melbourne. It's funny how these little decisions kind of in life kind of like create so much separation, like where you end up.
Yeah, Melbourne's a pretty cool city, though.
Yeah.
So there's so much I want to cover, but I want to go all the way back to soccer. You're like really good at soccer, is that right?
I was okay, I think. I mean, I was a goalkeeper, and the one thing with sports that you learn a lot, I think, and looking back now, obviously I have like a lot of like, I'm upset that like maybe I didn't become like this or that. I think learning how to fail is like really important. And in sports, you're growing up and you're constantly sort of, trying out for teams and trying to make like provincial teams and national teams. And each time you kind of go through these steps as like, you're like, I remember I was like 12 years old, and that's like the first big cut for like the take the players into like the elite like provincial training programs. And I hadn't like hit my growth spurt yet. Not that I'm huge now, but I was pretty short for a goalkeeper. So I didn't make that team. And I was like kind of devastated at that time. I was like 12 years old. I thought like my life was over. Like all my kind of like my close friends made this team, and they're like training with like professional coaches and all this stuff. And I'm just in the backyard kind of like practicing against the wall still. But then you kind of stick with it, right? If you care about something enough, you kind of keep working. And then so I made like the youth team of like a professional team that we had in the city. So I kind of started developing in that sort of space. And then eventually, I think when I was in grade 12, I got invited out to the national team to participate in the training camp. And I didn't end up making it in the end, but another failure. But I think that was like a cool highlight for me. Just like the fact that I made it there and got to like participate for a few weeks with like some of the best players in the country. That was kind of cool for me.
Yeah, that's pretty amazing, I think. I was so bad at soccer when I played. You should ask my mates. It's so bad. So I was a board sports kind of guy.
Yeah.
So yeah, very different paths in that regard. So when you came to Australia, did you continue that sport, soccer?
Yeah, for sure. I mean, and sports is one of the best things about sports, I think, is like the social aspect of it too. It's always it's like a great tool to have to network and meet people. So when I moved here to Melbourne, I started playing like in the Melbourne like intramural like futsal teams. Just like I lived in college in first year because I didn't sort of know anyone or have anywhere else to kind of stay. So I played for like the college team. And then from there, I kind of like got recruited to like play for like the university futsal team. So we were playing like the domestic competitions and kind of like moving up the league system that way. And then after a couple of years, I like one of the like sort of like semi-pro teams like in the highest like level here. They kind of like recruited me, so I started playing with them for like the last probably like 2.5 years. I was in Melbourne, so it was like a cool second life for me. I think I would be like training and playing on the side, like in front of like a small little crowd, and then coming to school and then going back to dentistry. So that was pretty cool.
Yeah, that would have been quite the juggle, I can imagine.
Yeah.
So you, from Canada, studied in Australia. A lot of people have done that. A third of our course was Canadian. I'm sure yours was the same, and I think it's even more now. Tell us a bit about that process and how hard it was or easy it was to do that.
Yeah, so I mean, first of all, it's a great opportunity. I think I had a random demonstrator like filling in for us in fourth year. And I was speaking to a patient. He's like, "Oh, your accent, like, where are you from?" I'm like, "Oh, I'm from Canada." And I was explaining like this whole reciprocal agreement. And this like elderly gentleman like picks his head up from the next like chair over, and he's like, "I was involved in that like decision making process. I was like on the committee that like." I was like, "Well, thank you. Like, you allowed me to be a dentist, so I appreciate that." So yeah, I mean, I think probably there's as many graduates now, like Canadian grads from Australian schools, as like some of the bigger schools in Canada. So, I think Melbourne Uni, like when I was in fourth year, the first year cohort coming in, there was about 30 Canadians, which is like a lot. So, it's going to create issues down the line with saturation and things like that, I'm sure, as with anything. But, it allows people who want the opportunity, who are like driven enough to actually like travel across the world and separate from their families and invest a heavy like financial kind of investment into becoming a dentist. So, the opportunities, the process is pretty streamlined. You finish your degree here. They offer the Canadian board exams in Sydney, so you can just travel to Sydney and write the boards over a weekend. And I mean, it's a pretty fair exam. I think it's like a pretty high pass rate amongst the Australian kind of Canadian grads as well. So, and then you kind of just have to wait a few months to get your degree and everything from the college in Canada, and then you're off to the races.
Yeah, okay. I actually did those Canadian board exams myself. So,
just for fun?
Just for fun, to spend $2,000 or whatever it was. So how'd you find uni? Like, what were the good bits and the bad bits? What advice would you have for students?
Yeah, I mean, dental school was a bit of a ride. I mean, I had fun in the social aspects of things. In my undergrad, because I kind of flunked out of my first year, I had an issue with like having a good group of friends like early on, because I lost touch with my friends from first year because they were kind of moving on. And I was kind of in a random program, taking arts classes and stuff. So when I got to Melbourne, I was like, I made like a conscious decision to like really be involved and try and get involved with like the student societies and things like that. So that side of it was really cool, and I learned a lot from that experience, and I think it's probably playing a role in the podcast and the things I've done since dental school. Because I think once you start doing these things, you kind of get that entrepreneurial itch a little bit too, and you're like, oh, it's possible to like make these things happen. So I think that was a really cool experience and valuable thing that I learned during dental school. Academically, first year in Melbourne, anyways, like the program that we have. There's a lot of like random stuff that I just didn't find useful for me. Anyways, there's a lot of like comparative anatomy, and like I remember like they line up all these like skulls, and we're like checking like the jaw and like the different tooth forms and things like that. And I was like, man, like this is so useless. I really don't like this. So that it wasn't until I think we got into the pre-clinic and we got the handpiece and we were kind of like prepping teeth and doing that. And I was pretty horrible to start, but the hands-on component was like, wow, this is like a fun thing. We get to like play around. It's like craft, right? You get to like perfect your craft. So,
sure.
Once that started going, pre-clinic was fun. And then, once you get into like probably second or third year, you're learning like the different specialties like endo and surgery, and you're seeing patients in the clinic. So that was really cool. All of that put together, I think, the latter years of dental school was like a really great experience. It was quite challenging, especially like oral medicine and things. Like I still have nightmares probably like trying to come up with a list of differentials for like white lesions and red lesions and stuff. So
did you guys have Viva exams?
Oh man, we had oral med Vivas in end of third year, and that was probably the hardest things. I've never been so stressed in my life. I remember like the night before, I was like literally like lying on the floor like in the apartment. And I was like, there's no way I'm going to pass this thing. Like, I know nothing. I don't know anything. Like, and sure enough, I got to the exam and it was like, they had the picture up. It was like an oral surgery one on one monitor. It was about wisdom teeth and things. And I was like, okay, I got this one. And it was like a random white spot lesion on like the palate. And I didn't know it. And I was like, oh man, you don't know it. So I was like,
yeah. You can't bullshit when you're talking to someone.
Yeah, it was tough. Yeah. So somehow they passed me. So that was good.
Oh, nice.
I must have done well in the wisdom tooth part of things. Hopefully.
Yeah, smashed half of it. That's perfect. Yeah, I think most dental students or dentists now have memories of the Viva exams, and it's usually a nightmare of some kind. But
yeah,
we all got through, and it's just another part of it.
Yeah.
So you graduated in 2016, as did I, and you went back to Canada. Is that right?
Yeah, that's right. So, graduated in 2016, December, had a couple of weeks of like pretty intense kind of studying for the Canadian board exams. And luckily you hear back on like Christmas Day or something too. It's just kind of cruel like, if you don't do well. So luckily I passed that. So, I sent all the paperwork in to the Canadian, like the Royal College of Dental Surgeons in Canada. And, once that kind of came through, started working. So I was working. I was pretty eager to get started, and I think that's where my kind of mistake comes. And we'll get into like the job kind of stuff, I'm sure, a little bit later. Because all my Australian friends were working for like a few months, and I was still kind of just sitting at home and like watching TV and stuff. So I was pretty anxious to get going. So I kind of just took the first few jobs that I got offered. So it was a bit of shuffling for the first few months to kind of get into a good opportunity and the right practice for me. But it was a good experience. I think, culturally, it's very similar. The dentistry is very similar. The only kind of difference is there's not as much Fuji, or GIC is not used that commonly, which was like, because that's like a great material. So, and then in Australia, we use it for like everything, literally. So I was like, it's kind of struggling with that. But apart from that, it was a pretty seamless transition, I think. Yeah.
So the dentistry you find, obviously, people have the same teeth, but then there's a few differences I wanted to ask about. Like, I know the hygiene practices or practices with hygienists, are much more popular, and you'll often run either two chairs or have the hygienist and go into their room for the consult. Tell us a bit about those differences.
Yeah, so that's definitely a great point. It's a big difference, and having started off in that kind of model, coming to Australia was a bit of a struggle too, like having to do my own cleans and stuff. I didn't take it too well at the start. I was like, why am I doing cleans? Like, it's a waste of
what a waste of time.
my training and blah, blah, blah. But you kind of, it fills your books, I guess, which is good. But yeah, so in Canada, most practices, the model is, there's one or two hygiene. And, as a business owner, the hygiene kind of covers your overhead. So it's a great model, like financially from the business sense. If the practice is running well, whatever the dentist produces is like bonus, and that's sort of his profit. And the hygiene just covers, the overhead expenses for the practice, which is pretty sweet. So, as an associate, it's a bit of a learning curve because you're in your chair, you got your own 1 or 2 columns that you're doing. And, in between procedures, you got to duck out and go to see the hygienist to do checks and recalls and all that. So, for production wise, it's pretty good because you don't spend that much time for like whatever in Australia, we have like your 012s and stuff. Because everything's kind of already done. The extras are done. You just kind of walk in and quickly look at the bite wings and then talk to the patient. And usually if the hygienist is pretty good at their job, like they've already diagnosed it for you. So you kind of just be like, yeah, that makes sense, that do that. And you kind of move on. So that's good in that sense. I think the only negative is the sort of the rapport building side of it. Especially if you're busy in your books, it's tough to spend the time with the patient to really build that trust and rapport for like bigger cases. Especially as a new grad, if you probably don't have the confidence to kind of walk in and be like, yeah, you need like 3 crowns and just walk out of the room. You probably got to build a little bit more relationship first, so it might take a bit longer. But in Australia, I think that's the plus because you're doing the hygiene, you're spending the time, so you're more likely to get case acceptance, I think, on a lot of like bigger things. So that's pretty much the main difference is that way. You got to kind of time it out. So in the middle of your procedure, like after you etch or something, you got to like quickly leave the room and like come back in and kind of keep going. I kind of forget now. Like I had like good points in the treatment row. Like, okay, so we just got to let this sit for a few minutes on the tooth and then I'll come. And like, so the patient shouldn't really know that you're just like leaving treatment to go do other things as well. So.
But it's more accepted, isn't it? In Canada, like most practices do it that way, so patients expect that to happen. Because I couldn't imagine that working particularly well in Australia. I'm sure it could, but you'd have to train your patients into it. We've got a hygienist at our practice, so I don't do many cleans, but we still see our 012 like regular recall exams in our room. Even if they're getting hygiene at the same time. Yeah. And I think that is important. Although of course you could do it the other way, but you want to be building that rapport. And these recall cases are the ones that sometimes will turn from someone who's happy with their aesthetics to something much more significant. And that's only if you've got the time to chat with them and to actually find that out.
Yeah, for sure. So I think it's a big system like change. In Canada, I would say 95% of practices have hygienists. Like it's very common, I think it's weird. Like a patient would find it weird, I think, if they come into the practice, then the dentist is doing the clean. One is probably we're not that good at it.
Let's be honest. That's true.
Like the hygienist, like they book an hour. Like here in Australia, like we book like 30 minutes to do a clean and like a check and bite wings, or 40 minutes, whatever it may be. The hygienists in Canada pretty much spend an hour like standard. So they're like hand scale everything. And so it's like a different experience altogether, I think.
That's a good point. They've got the rapport. So in the end, it does work out, I guess, as long as you're working with a good team and you've got a really good hygienist who can talk your patients through bigger treatments. So you're now in Australia, but tell us about the first few practices. You did make a comment before that you said you made a mistake by basically accepting what first came across your plate. Tell us about that.
Yeah, so it's a big journey. I was after we graduated and wrote the exams. I was traveling for a little bit, for a couple months. I was in Europe. My wife's from France, so we were kind of there. And I was like applying for jobs online. And this one practice was opening up near my hometown, like 5-10 minutes from where I lived. Like a scratch practice opening up, and they're looking for like a principal dentist. In the first month, I saw 3 patients. So I'm sitting there in the back office. Luckily, there's a computer, so I signed up to AGD and like dental. What's it called? Dental XP, I think. And I was like doing all these online courses. I'm like, well, I have nothing else to do. So I was like racking up like CPD hours like crazy. But my hand skills were like 0 because I haven't like seen a patient.
Yeah. Did you start your podcast in that time?
No, I should have. I was procrastinating. I was like, well, not procrastinating. I was doing CPD, but I wasn't like thinking about that. I was just kind of pissed off that I wasn't seeing patients. I was there for I think I was there for like 6 weeks, and I told the boss like I can't work. Like I'm not seeing patients. I gotta quit. So I quit that place. I left that practice, and I sort of got a job with like a corporate chain. Nice practice, like right in the city, like in like midtown Toronto, like really kind of high end looking practice. And it was a little bit busier, but there was no principal there. I had like no mentorship. That he owned like 8 practices or something, like, which is pretty common in Canada, I guess now. So again, I wasn't super busy. So I was there for maybe like 3 or 4 months, and I was just doing kind of fillings and like clean, like checks and stuff, like maybe 1 or 2 crowns and things like that. So I wasn't really clinically getting much experience either. So I ended up leaving that practice, and then I kind of moved outside the city, like 45 minutes north of where I lived. A really nice, like well-established practice. I was like 20 years old. They had multiple associates, and they would just feed me patients, like mostly just fillings and restorative, but I was like constantly booked, like good production, good experience, good mentorship. So that was like my first good job after probably about like 5 months of working. And I was finally like getting my hands wet and trying things and learning things. And I had a really good nurse, and the nurse had been a nurse for like 20 years. So she helped me a lot as well, like streamline the process. Yeah.
Yeah, it's so true. Like, that's such a good tip. Your nurse, if you're a new graduate, if you have an experienced nurse, which hopefully you do, they will help you so much. Like, they might just be holding the right instrument, and you're in your mind like, what's next? And it just flows, and you think, oh, thank you. It's just so good. I've worked with a few really good nurses.
I think, like we talked about, it's like you gotta be quite humble, I think, especially when you're first starting out.
Sure.
So
you have to take their advice.
Yeah. So I tell the nurse, I'm like, what does the principal do? And she's like, oh, he goes like this. I'm like, okay, give me that one. I'll use the same thing. Like, I don't know. Like, so it's like a personal like cheat sheet to have. So that was great. I really enjoyed that practice. I was really sad, when I had to like move back to Australia to like kind of leave that, because I thought that'd be a practice where you can kind of be there for a long time and kind of grow into it and eventually like buy in and stuff like that. So that was really good. Another job that I got was like an emergency practice in my hometown. So I was there on Sundays. The principal was like a prosthodontist who also kind of did general dentistry as well. And that was like by far the best like experience I ever had. A lot of extractions, a lot of pulpectomies, a lot of endo, and anything like he'd be there doing admin stuff on the Sundays that I was there. So anything that I walked in, I had no clue what to do, like re-cementing like veneers and posts and like all these things. He would just come in and he's like a gun. So he'd just be like, yeah, you go like this, and this, and then it works every time, like a treat. So I really learned dentistry from him. Like he taught me a lot of dentistry. So I'm like really like forever grateful to him for teaching me all that. So I think that's the main tip of it. I mean, for new grads like listening, one is like, even if you are a little bit overly eager and you get a job, don't be afraid to move on pretty quickly. Don't stay around if you're not happy or if you're not growing clinically. And 2 is like mentorship is like everything. You got to try and find an opportunity in the practice or in one of your practices that you have someone there who has a little bit more experience, who can actually teach you a thing or two that you didn't pick up in dental school, because it makes a big difference in your sort of growth trajectory.
For sure. There's only so much we can learn in dental school. They teach us to be safe clinicians, but they don't teach us everything. Obviously, they don't have time. They do a good job with what they've got. And having someone there, to help you out if something goes wrong, or just someone you can ask the right questions to. I think it's important also, if you are looking for a mentor, don't expect them to like give you some scaffold mentoring program. You need to make it work for them. You need to be able to go to them when they've got time. Don't waste their time. Ask the right questions. Do your own research, and then you'll get the right outcome. I think some people kind of just expect it to be handed to them, and I don't think it's going to work that way.
Yeah, I think that's a great point. I mean, with the podcast too, when I first started, I was like reaching out to a lot of people, and and like we me and you have talked about before, like we're really, both of us are quite big on like, self-improvement and things like that. So I listen to a lot of podcasts. I listen to like a lot of interviews and things. And one of the guys that really early on sort of the social media marketing kind of stuff is Gary Vaynerchuk, Gary V. So his like whole, concept of like, like the thank you economy, like, and like jab, 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 right hook, his books and stuff that he wrote is like, in any relationship, you have to bring the value to get value out of it. You can't just approach someone and be like, help me do this. You need to offer something to someone so they have incentive to actually help you back as well. So that's sort of like, that's how I started the podcast. That's how I got to like some like my early like bigger like profile guests and things, is you got to approach people with ideas and tips to help them or help them out in some way, and then they'll reciprocate that. So and I see a lot of young people who are really bad at that, unfortunately. Even people, I had like people message me on Instagram like once I kind of started growing the podcast a little bit, and they'd be like, oh, how much money do you make, or how much this and that. earn some guy he was a dental student at the University of Toronto. He's like, if you want to grab lunch with me, I'd be open to the idea of it. And I was like, what? Like, you messaged me? Like, that's such a weird thing. That's a weird thing to say to someone.
Yeah, well, communication is a pretty important part to being a successful dentist. And one of the things that worries me about the way that universities accept their intake is that they look mostly at, just marks and none of that EQ or that communication and empathy and all that. And yeah, I think that dude might have missed it. Sorry, buddy.
I wish them luck in his future career. So.
Absolutely, yeah. He might need to do a course with Mark Assad.
Yeah.
So Canada to Australia, you moved. Is that because your wife studying medicine and she's continuing on that path here? Is that right?
Yeah, that's right. So she started off a year after I did, and so sort of in her final year. They have a research component, so she came to Canada for 6 months to do that at the Children's Hospital in Toronto. And after that, she had to move back to Melbourne to finish off her second semester. And then she kind of got into internship and things here. So it just kind of made more sense for her career and for like both of us really not to be apart. So I just kind of moved back in May of last year.
May of last year, okay. And so in Australia, you've had more than one role as well.
Yeah, so I'm currently, I haven't left any jobs. So I'm working in like 3 practices.
What I'm getting at is I know you work really, really hard, and I'm in awe, and I'm sure I couldn't do it myself. But so 3 practices. Tell us about the practices you're in now.
Yeah, so look, I mean, I think it's coming to an end soon in terms of me working so many days. In Canada, I was working 7 days a week. At the peak of it, and on a couple of days a week I would work in like 2 practices. I worked in the morning. And I think you had Nav on your podcast, and he was talking. He did. So that's when he told me when he's talking about burnout. I was like, oh man, I gotta like really reconsider things, because yeah, for my first year I was working in at points 4 practices, and I was working like a morning shift from like 8 to 2, and then 3 to 9 shift at a different practice, and a couple of days a week, and I was doing 7 days. Because to me that was like boot camp. I was like, I need to get my clinical skills. I need to be doing as much work as possible to like get my hand skills kind of going and learning things and experiencing it. And, now that we're a couple years out, you kind of the baseline's there. You know how to do things. I think it's more and it's more quality over quantity now. So while I've been doing 6 days for the past about a year now in Australia. I'm trying to cut that back soon, and trying to focus on working on learning dentistry, like in terms of doing more CPD and things as well. And I think you have more energy at work. You're more productive at work if you're not overworked or burnt out. So I think I'm trying to get that better work-life balance for myself as well.
I think we're all different. Some people can handle that a lot better than others. And I know you've worked hard in your childhood with soccer and school at the same time and all the rest of it. I personally, I don't think I could do that. I currently work, you call it 4.5 days or a 9-day fortnight. That suits me really well. I work hard when I'm at work. And then when I'm not, I can take a breather, so to speak. I think burnout is a real risk. And I think a lot of us come out of dental school, university, just ready to get at it. But you will very quickly find yourself in that difficult situation, in my opinion. And I've even experienced periods of time where I'm starting to get over it a bit. And I know it's just because I'm having, a couple of difficult cases in a long week. And it's, you can definitely feel it. So you felt like you've experienced a little bit of burnout coming up, I guess. What's your plan with that?
Yeah, I mean, you always hear about it, and, it's talked about a lot. And, initially, like you said, I've always had like a high motor for like just trying to work a lot and do a lot and take on a lot. I mean, in like dental school, I worked like 30 hours a week, like part-time jobs. And I was kind of used to like just go all the time. But clinical dentistry is different. I think the stressor of it is different. It's not like you're just doing things and you're busy. It's just the constant like stress of the work, like clinical procedures and things that you're kind of dealing with. And I'm starting to kind of feel it a little bit. And the podcast that you had with Nav, like he really made some great points about like starting to hate dentistry, and that's why he became a business owner and multiple practice owner, so you can actually like stop practicing clinical dentistry. So, I mean, I don't want to get to that point. I love clinical dentistry. And reasons I started the podcast was to talk dentistry, and I think it's important to kind of keep that passion for what you're doing. And the feeling of burnout sometimes can get in the way of that. So, my plan is obviously I'm gonna try and reduce some days. So over the next few months, I'm gonna start to cut back. I think hopefully like cut back to 5 pretty soon and then drop to 4. I think 4 is like a good balance. Especially, yourself too, like we got some like side things that we're doing and we enjoy doing with the podcast, and like I got the Noobie Dentist study club, and hopefully some other conferences and things coming up as well. So I think it's important to follow those passions as well. If you're constantly working, one is you don't have time to like grow yourself. I think if you're just getting to that like the rat race of just like work, you don't have time to take a step back and be like, okay, let's over the next 3 months, I want to get better at like prosthodontics, and then you get some textbooks or you're doing some online CPD. So I think you're like, maybe in the short term you're making more money and you're more productive, but I think long term, if you kind of step back and zoom out a little bit, you'll see that you're probably not as productive in your career if you're overworking yourself. So
yeah, that's a really good point. In our early years, we, even though we might be producing fairly well and earning good money, it's nothing compared to what we'll be later on when we're more efficient doing more complex procedures. So if you're just working for the sake of working and just smashing it out, you don't have time to work on yourself or on your own understanding, new procedures, and all the rest of it. And so you're stifling yourself. And they say 10,000 hours to be an expert, but those 10,000 hours need to be focused and need to be actually to learn more. And I personally, and I don't know if you agree, but I find the more I work, the less I can have the capacity to do CPD or to do like online learning or any of that kind of stuff. And like you said, we both enjoy our podcasts and what we're trying to do for students and new grads. So that takes a bit of time as well.
Yeah, for sure. I mean, the 10,000 hour rule it's awesome with Malcolm Gladwell. But I think they talk about it, like you said, it's not just the hours, it's targeted practice. So you need to be specifically doing things and doing it with a goal in mind and not just kind of going through the motions. Yeah, look, I think dentistry is great, but it's stressful work. I mean, one is like it's physically hard on your body, like that your back and your shoulders and your neck, and you'll feel it after a few days of work. And if you're ongoing and not giving yourself enough recovery time, that's one side of it. It's physical. Second is mental. Obviously, like the focus required for procedures and the stress of procedures. Literally last night, man, I worked 6 days in a row, and then I have 2 days off because it's a long weekend. I'm doing this like big case of like a couple of bridges and things. And literally last night I had a dream that I was going to cement the bridge, and one of the teeth that I was like as the abutment tooth for this bridge like came out. And I was like, oh my God, like what do I do now? Like my whole bridge. So I woke up in like a sweat, man. So look, I that's an ominous sign.
Yeah. I've definitely had I've had cases that have made me or affected my sleep a little bit. I've never had one where I dreamed the tooth came out. That's a good one. I like that. But it does show that like it is very much a mentally draining profession, especially if you're trying to do really good work and trying to expand your boundaries at the same time. I find with dentistry, I've been surprised at how emotionally draining it can be, particularly with, for me personally, if I'm treating kids or a difficult kid. I find that to be a really difficult appointment mentally, especially if the poor kid has like, gross caries and it's really not their fault. And then you've got to do your best to work with them. And sometimes, you just can't do it. And that is emotionally difficult. So there's a lot that goes into it, physical, emotional, mental. We're in an interesting profession and there's some awesome things about dentistry. We earn great money. We can have flexibility with our time and all of this, but it does come with a cost. I mean, we've got to recognize that, I think, and manage that. Otherwise, well, that's why mental health is such a big issue in dentistry as well.
For sure. I think, the kids one's great. I'm just kind of waiting for the point in my career where I can just be like, I'm not seeing kids. I'm sorry. It's stressful. I mean, yeah, like you said, the kids are coming in. They're not happy to be there, obviously. The parents don't really do a great job, I think, of like preparing them to come in, or like the threats, like, oh, if you don't like cooperate. They got to pull the tooth. I'm like, that's not helping.
No, that's definitely not helping. There's so much the parents do that is not helping.
I think that's a big area of like exploration. I mean, I'm sure it's a known thing that you got to coach the parents as much as the kids and things like that. But that's a big one. And in Australia, there's like that gray spot, which I think is quite frustrating. So I'm sure we have like the CDBS program for kids that come in with some government allotted funds. Those kids that you can't see in the chair, that they don't tolerate it, and then if you refer them off, I don't think the specialists accept CDBS. Do they? Like,
I don't believe they do.
So that's such a weird, and that's a very like stressful thing, because you think you're not doing right by them if you can't treat them in the chair. And then if you send them off, they're not going to go a lot of times because of financial reasons and things. So then the child's kind of stuck in limbo without treatment. So yeah, definitely the kid side of it.
Yeah, I've seen that multiple times, and it's really sad. I had one the other day actually, where there was a 6-year-old who had multiple carious lesions identified when he was 4 years old, and he came in, nothing had been treated. Luckily, it seemed to have almost stabilized, maybe. But then there was his 4-year-old brother, who at the time was 2. They were talked to about why this was happening. It was bottle feeding at night with milk, and then the 4-year-old now, who was 2 at the time, has the exact same problem. And he's thinking, but which obviously didn't get through.
Yeah.
Yeah, it's really sad. So it's definitely, that's a stressful part of our work. Let's switch gears. So the podcast. Tell us about the podcast and why you started it and what's going on.
Yeah, so it's been a fun ride. I started the Noobie Dentist podcast. I think it was late 2017. I'd kind of wanted to do it for a long time. I was procrastinating. With these things, it's a little bit tricky. Like, it's hard to put yourself out there and like create content. As I'm sure you're experiencing now, like kind of starting it off. You're not sure, like, will anyone listen? Will anyone care? So that kind of the self-doubt, like imposter syndrome thing, kind of kicks in a little bit. So finally I decided to like bite the bullet and kind of get it going. Sort of my strategy was, I was really big into like I said, Gary Vee and his like social media stuff. So for me, it was like a fun marketing kind of thing. So I started off with the Instagram page, the Noobie Dentist Instagram account. And I started just posting like terrible quality photos of like my work with like intraoral cameras and like iPhones and like just like really low production value. But it was nice. I mean, I grew it to, I think it was about like 1,000 sort of followers when I launched the podcast. So the idea was, have some sort of a base that when you launch the podcast, you at least have some sort of an audience as a starting point anyways. And so, yeah, Instagram's really been like the main ecosystem for the podcast. Most of the listeners are pretty active on, most of the guests are pretty active on Instagram. So that's where I recruit them and kind of meet them, and we do the shows that way.
It's quite a community on Instagram that I must admit I hadn't explored as much as you had. Yeah. And you probably think I'm just some old timer because of that, although I'm your age. But so like, interestingly, I know a lot of people through the Facebook streams, and that's the area that I'm kind of discussing with my guests. So yeah, it's interesting. We're kind of doing parallel pathways at the moment, I think.
Yeah, I think I was giving you a hard time for being on Facebook. So I think all your guests are like plus 40 surely by this point. So.
They've all got the experience. That they can pass on.
So Instagram's awesome. It's so open. It's all visual. There's not a lot of text and stuff. So people I think there's less like criticism on there. It's a bit of a healthier, I think, more supportive community than some of the Facebook groups and stuff that I see. Especially I think with the cranky old timers, sometimes like, they get pretty nasty on like some of the Australian like DPR groups and stuff like that, when people are kind of brave enough to post a case. They don't always get support, which I think is a little bit disheartening for the community. But I found Instagram to be quite nice and quite friendly, and a good place to kind of share cases and find mentors and things. So in terms of the podcast, it started off just interviewing like general dentists in Canada, really trying to get like a Canadian sort of podcast download base going. And from there, I just kind of branched out into the US, and then kind of like internationally, getting some dentists from the UK, in Asia and Australia, obviously. And yeah, it's been, I think I'm about like 35 or 6 episodes in now. And it's been growing nicely. It's just cool to, have people messaging you from like around the world and kind of saying that they learned a thing or two from the podcast, and that value that you can kind of create and introduce to the dental community is pretty cool, and a nice legacy to leave behind, I think.
Yeah, it's really awesome. You've done a good job, and you've got quite a few podcasts out there now. I really like what you're doing.
Thank you.
So you obviously listen to a lot of podcasts. What other podcasts do you recommend?
Yeah, so I mean, in the dental ones, there's a lot now. My first sort of podcasts were like Howard Friends, Dental Town, Mark Costas, Dentalpreneurs, Jesse Green with the Savvy Dentist. Those are like the main three, and that was because in dental school, especially in fourth year, I was really interested in the business side of dentistry, and so I was just consuming those podcasts, and also the Shared Practices podcast. So there's like so many great resources, and you pick up a lot of things, and you kind of feel like these people are like your best friends, your mentors, because you got their voice in your head all day. And it's cool. I mean, with the podcast, I've had the pleasure of like meeting some of these people and interacting with like Jesse Green. Howard Friend was like my role model for a long time, and I got a chance to like have dinner with him in Toronto and have
Oh wow, that's awesome.
and go on his podcast. So it's cool. I think once you put yourself out there, it's a positive thing that if good things kind of come and opportunities kind of open up for you, which is quite nice.
Yeah, I've listened to a lot of those podcasts and have the same kind of experience. I think other ones I've listened to, there's the Dental Guys, which is really clinical, but I found that to be pretty good. And then Dental Hacks as well, which there's a lot of banter and stuff, but I've enjoyed a lot of their stuff, and they've been around a long time.
Yeah, Dental Hacks is great. They're killing it. I think they're like well over 1 million downloads now. So
yeah, they're definitely the biggest.
Yeah,
is that the goal? Is that Noobie Dentist is going to that?
If I get to 100,000, I think I'd be pretty happy. But millions, it's a ways off, I think, for sure.
That's pretty awesome.
Yeah.
So what's the future like? Well, I guess clinically, are you ever planning on specializing or anything like that?
Probably not at this point. I was pretty keen on oral surgery during dental school. So like one of my friends and I, like we're like dead set on like max fax for a long time. And then you kind of get out of school and you get out of the study mode. And I struggle now. Like I bought a textbook the other week and I'm trying to read it, and I last like 10 minutes and then my attention span's gone. So I don't see myself like doing like a formal academic specialty. But obviously I think it's important to keep growing skills and stuff by like CPD and things like that. So I'll definitely do that route and like maybe do some structured sort of CPD programs. But like a formal academic specialty, I don't think that's in the cards. What about yourself?
Yeah, I feel the same way. I got into this as a dental assistant, working with a general dentist, and I really liked that broad spectrum. You can see your patients for most, if not all, of the procedures, and continue that relationship. I've also worked for specialists as an assistant as well, and really noticed that incongruity with your patients. Like you meet them, you treat them, you review them, they're done, and that I found that actually a little bit. Even this, I only worked for this one I'm thinking of for 6 months, and I really noticed that that's not as fun. So, how about for Noobie Dentist and the podcast and things like that?
Yeah, so for the podcast, I've always liked to have like little targets to kind of aim for. And they're like small steps, like like reaching like 10,000 downloads was like a big milestone. That was kind of cool when I got there.
Yeah, that's awesome.
And my next one was like 100 episodes, so I've slowed down pace a little bit. I need to pick it up, but I think if I can get to 100 episodes, I think that'd be cool. Long term, I think the Noobie Dentist as like a brand is something that I want to develop into like courses and conferences and things like that, and collaborate with like other courses and things too, which I think is a great opportunity. But the podcast itself, I think the coolest thing that I can kind of envision long term is to like pass it on to somebody else in a year or two who's like a new grad as well, who's like equally driven. So I think that'd be cool if it can live on independent of me. That'd be sort of like the main goal for it. It's not really like a money making endeavor at this point. So I think just like the content and the community that it's created, it's like its own little entity now. It would be cool if it lived on with somebody else at least.
That's a really cool vision. I've never thought of that or heard of that. That's really cool. I'd like to see where it ends up. And definitely the idea of trying to help, organize courses or organize things. I think that's something we mutually share as well. So when you do podcasts, you like to finish with a rapid fire. So I'm going to just throw those questions back at you.
Let's do it.
Your first one often is, what's your favorite pizza topping?
Pizza topping. I have a weird one. We made some pizzas last night, and it's definitely red onion, I would say.
Red onion. That's so funny. It gives a lot of flavor to the pizza. It really brings it to life. I can see what you're saying. Fair enough. Favorite band or artist?
Favorite band, I think classic rock's pretty big because my dad was a big classic rock fan. So I grew up listening to like Pink Floyd and the Beatles and like Zeppelin and stuff. I was a huge Pink Floyd fan. Like I had posters on my wall of like the Dark Side of the Moon, like Pyramid and all that kind of stuff. So I would say it'd be Pink Floyd.
Yeah, fair enough. Good choice. What's your favorite tooth to work on?
Favorite tooth to work on? I was thinking about this. Probably like an upper 6, I would say.
Yeah, I'm probably the same. 1/6 or 2/6?
So I'm left-handed. So for me, I think probably the 2/6 is easier for. No, sorry, the 1/6 is the 1/6 is easier for like indirect vision. The 2/6 is a struggle because you're like retracting. It's just like it's tough to work with that side. I think same. I could be the opposite for you, I guess.
Exactly. Yeah, it's exact opposite. 2/6 is favorite and 1/6 is a bit tricky. So there's some ways you can hold your hands and support with your other hand at the same time that can help. I might do a blog post on that sometime soon. So what, if not dentistry, what would you be doing?
I'd probably say like soccer player.
That's awesome. Yeah. I definitely can't say soccer player. What's the most impactful book you've read?
Ooh. Probably I would say Rich Dad Poor Dad, like Robert Kiyosaki. That one, and I must admit I didn't read it as an audiobook, but just it's well quoted as being like one of the top like business books of all time, and not because it's like very technical or anything like that. It's very basic, fundamental like principles of what's an asset, what's a liability, and like how to accumulate wealth. So I truly I think. Like when I have kids, I'll give them like they should read that like in elementary school or like high school because it's very basic. But I think the mindset of how to create wealth and not just be working perpetually like is a big one. So I think definitely Rich Dad Poor Dad I would say is the book.
It's funny. I've listened to like audiobooks, which is the future of books for sure. But read like tons and tons of these style of books, but I haven't actually read that one or listened to that one.
Oh, you have to.
It's crazy, but yeah, I know I've heard so much about it. It's quite a pioneering book for its time as well.
Yeah, for sure. Yeah, it's a great principle, and I think you can't go wrong with it as a choice.
What's the procedure in dentistry that makes you think, "Why am I doing this?"
Some days it's everything, but
definitely.
That's tough. I think endo I love. Like it's like a love-hate thing. I know most people would probably say endo. It's not that for me. I would probably say it's like a tough, like a 3-7 like DOL, and you gotta like put a rubber dam on because you're trying to do things the right way. And it just sucks. Like nothing's fun about that.
Yeah, fair enough. I think a lot of people say endo, but endo is all right when it's going well. It's just that when it's the one where things can maybe not go so well. Make sure you know your endodontist and have a good relationship. That's pretty important. Well, thank you so much, Omid, for spending an hour with us. I really appreciate what you're doing, and it's been really good to meet you and have a good chat. So all the best to the podcast and everything you do in the future. Thank you again.
Yeah, thanks, David. Thank you for having me on your podcast. I'm excited to see your growth and where you're going to take things with your podcast. And I've subscribed already, so I recommend your listeners subscribe if they haven't already. And I leave you a good review as well. I think that will help. And you got to hopefully return the favor. That'd be sweet.
Yeah, definitely. That's what they say. You got to ask for reviews, but that's not been something I do yet.
Yeah.
But thank you. You take care.
All right. Take care.